Okay, this time we're going to talk about HMIS, monitoring, and evaluation. So earlier we talked about hospital management information system. This time it's just a short lecture on how you monitor and evaluate our HMIS. So monitoring is the systematic collection, analysis, and use of information from programs. And you have three basic purposes. You have learning, you have monitoring, and you have steering. So basically, when you say learning, you are learning from your experiences. If you have certain weaker areas in your framework, then you can learn from that. Next, you can monitor the function. And finally, you can steer your decision. So you can decide to improve upon something, you can decide to let it stay and improve upon something else, and so on and so forth. Meanwhile, evaluation is assessing an ongoing or completed program or policy as systematically and as objectively as possible. So the object is to make statements about the relevance, effectiveness, efficiency, impact, and sustainability. So basically, when you're monitoring, it's a collection of data and information from programs. Meanwhile, evaluation is all about your performance determination. Okay, so the purpose of this one is to review the system in place of the National Health Strategic Plan, which comprises all major disease programs and health systems. So a robust monitoring and evaluation system is acquired to assess the effect of integrated service delivery. So basically, when you say monitoring and evaluation, you just want to see if your program is doing good, if your program is doing well, if it's achieving its goals, if it's progressing, or if it has many more problems that you have to fix. Okay, so M&E framework is a core component of current efforts to scale up for better health. Global partners and countries have developed a general framework for M&E of the health system strengthening, or HSS. So this is your framework, no? This is just like your PRISM framework, but this time it's discussed in, or it's represented in boxes. You have your inputs and processes over here. You have your outputs, outcomes, and the impact. So basically, when you say inputs, this is your information, supply chain, health workforce. So ito yung ginagawa natin to effect change, or ito yung resources natin. Next, you have outputs, which is your intervention, access, and services readiness. So basically, after nating gawin or after nating mag-provide, ano ba yung nangyari? Okay? And then after your outputs, you have outcomes. Sir, what is the difference between outputs and outcomes? So basically, outcomes is just what happens after your output. So ano ba yung long-lasting intervention natin? Ano ba yung nangyari, or what happened to the community itself? When you talk about impact this time, it's about the improved health outcomes and equity. Ito na yung pinaka-goal natin na mangyari. Okay, so input is basically what you put into the system. These are your resources. Output is what happens to those resources. Outcomes is what happens to the community. And impact is how long, or the long-lasting effect of what happened to the community to your project. Next, relationship between M&E with HMIS indicator. So an indicator can be defined as a variable whose value changes, definitely. Number two, it measures the value of the change in meaningful units. Number three, it focuses on a single aspect of a program or project. So these are indicators that we can have. We have 5 broad categories: reproductive health, immunization, disease prevention and control, resource utilization, and data quality. So these are your key performance areas and your key indicators. So basically, I'm just going to teach you how to interpret this table. You have your key performance area here, which was mentioned earlier. You have 1, 2, 3, 4, 5, and then you have your indicators over here. Meaning, how are you going to evaluate the effectiveness or the quality of reproductive health in a certain area? You have to look at these factors. You have to look at family planning. You have to look at antenatal care. You have to look at proportion of deliveries attended by HEWs. Okay, so another example, data quality. How are you going to look at the quality of your data quality? You look at the reporting completeness rate, the reporting timeliness rate. Okay, so these are factors that you have to look into when you want to evaluate a certain program. So itong 5 program na to, ito yung current na ine-evaluate natin. One good example is the Stop TB program. So with the vision to be a TB-free world, the goal of the Stop TB program is to dramatically reduce the global burden of TB by 2015, in line with the Millennium Development Goals and the Stop TB partnership targets of the World Health Organization. So one of the main objectives of the program is to achieve universal access to quality healthcare. So basically, this program is made to stop tuberculosis. And then here are your determinants. So you have your TB patients on DOTS or direct observed treatment centers. You have your TB case detection. You have your TB treatment outcome. So these are metrics, meaning these are figures that you can measure to see if your program is effective or not. Okay, so again, here are the indicators as mentioned earlier. Number of new smear pulmonary TB cases enrolled in the cohort, TB case detection, number of new smear positive, new smear negative, and so on and so forth. Okay? So basically, we're trying to measure all of these things. These are things that we can measure, no? Pwede natin siyang bilangin. And while we measure them and after we measure them, we have an idea if our Stop TB program is working or not. Okay, so that is your hospital management information system monitoring and evaluation. If you have any questions, you can just simply ask me. So thank you very much for listening. I know this is quite a long lecture with a very fast discussion, but I guess you can use the YouTube feature to slow down the presentation to, I guess, 0.5 speed, so you can further listen if you don't understand, or you can just replay. Okay, so thank you very much again. I hope you learned something new. Goodbye for now.